I want to take a moment today to start a conversation, not to explain everything, not to label anyone, but simply to open the door. I'm speaking as a mother with lived experience and as a provider who works closely with children and families every day. And if you're here watching this, chances are you care deeply about children too, whether you're a parent, a caregiver, or someone who works with this population. This topic, autism, neurodivergence, and how children experience the world, is not something we can cover in one video. So today is not about signs, checklists, or diagnoses. Today is about awareness, understanding, and creating space for conversations that many families are quietly having on their own. As a parent, you spend so much time watching your child. You notice how they respond to noise, to change, to people, to expectations. You notice what drains them and what brings them joy. And sometimes you realize that what people casually call kids being kids doesn't fully capture what you're seeing. As a provider, I see this from another angle as well. I see children who are bright, capable, and trying their best, but who experience the world differently. And too often, their struggles are misunderstood as behavior, when what's really happening is a nervous system working overtime. For some families, learning about the autism spectrum becomes a turning point, not as something to fear, but as a way to better understand how a child's brain processes the world. And for others, this conversation simply helps them support a child with more compassion and clarity. Both are valid. Not every child who struggles is autistic, and no single trait tells the whole story. This is about patterns, context, and listening to children and to ourselves as parents and caregivers. This is the beginning of a larger conversation. Over time, we'll talk about how to recognize patterns, when to seek support, how to advocate for children, and how to create environments where kids can truly thrive. If you're a parent with lived experience, a provider working with children, a caregiver, educator, or advocate, there is space for you here. We're just getting started with this topic, so if this resonates with you, even a little, stay with me. There's so much more to unpack, and this conversation is one we don't have to have alone. Stay tuned for more. Disclaimer: his content is for educational and informational purposes only and does not provide medical or diagnostic advice. For concerns about a child's development, please consult a qualified healthcare professional.